Hey everyone, this is Dr. Ellie. I'm here with my pod, I Heal Kids. And if you don't know me, I am the founder of Middle Path Integrative Pediatrics in Asheville, North Carolina. And I'm a holistic pediatrician. I take care of kids 0 to 21. And I also do functional medicine for ages 2 to 102. If you don't know what functional medicine is, please see my other podcast that we will link in the show notes. And today I'm super stoked because I am talking to Dr. Julia. Dr. Julia Sadove. Am I saying that right? Sadove Lopez. Okay.
Exactly.
Amazing. She's the founder of Oris Wellness, which is an amazing consulting company. It's dedicated to empowering parents with the knowledge and confidence to make informed decisions about their kids' oral and airway health. Which, come on, we all need to know about that. Who doesn't need a dentist? So, through her one on one sessions, she provides objective guidance on treatment options. She helps families connect with qualified airway providers in their areas. And her mission is to bridge the gap between professional expertise and parental intuition, which I also agree is amazing. She is super well trained. She originally trained in biological and airway dentistry, which, if you don't know what that is, we're going to talk about it, while practicing in Chicago. And now she calls Portugal home, which is so super cool. I'm super jelly, and I wish I was there with you.
It's fun. Thank you so much for having me today. I absolutely love the chance. I know that often dentistry gets pushed aside as sort of a separate category. So I love to be able to meet with the medicine world and make sure we're working together for the best outcomes for
For
overall
kiddos.
holistic health. Yeah.
Yeah, 100%. And it's not that often that I get to talk to biological dentists either. So I'm super excited to have you share your story. So kind of I mean, this is really deep, niche. So how did you end up focusing on pediatric airway health and holistic dentistry?
Yeah. So I definitely had a different way to approach it than most people who find their way into this area. I think most of the people who come into it come in through really the personal struggle that they've had for their own children. I had sort of a fortuitous series of events. I was practicing regular general dentistry for a few years, and then I relocated to Chicago. And honestly, a turn of events had me looking for a new job in the city of Chicago in a hurry. And I found a job that was advertising as holistic dentistry. I quite honestly didn't even know what that meant at the time. Nothing in my life had really been focused around holistic health or anything like that. I've been very conventionally trained and a conventional upbringing. And I sort of went in there with an open mind just to kind of find out more about the opportunity. And that was a biological dental practice. So it was a lot of new discoveries of thinking about how dentistry could be practiced through more of a lens of how either the dental materials that were being used or different kind of looking at more of really what was happening on a cellular level with our biology and how connecting that oral systemic health in a different way. So a lot of it rotated. I saw all ages. So a lot of people who had questions about the mercury fillings that they had, people who had questions about previous root canals that they'd had, just sort of topics that conventional dentistry says, this is fine, this isn't affecting your health, but more of a different perspective might factor into some people being more affected by certain materials or certain procedures than others. So that was kind of the first dip down the rabbit hole, as kind of rediscovering the ground below me and seeing everything through a new perspective. And while I was in that clinic, I had the really good fortune of attending a conference where I connected with Dr. Kevin Boyd, who's one of the biggest pioneers in the country in the US when it comes to airway dentistry. He has like a whole kind of fix before six is like a slogan, because really a lot of conventionally trained orthodontists were looking at only children who were 12, 13 plus, and a lot of pediatric dentists weren't necessarily attuned to the fact that some of the problems that their patients were facing could be addressed earlier, because none of this is really taught in dental school. The opportunity to kind of take this early approach and look at how our growth and development might affect our breathing. So that's kind of the whole idea behind Airway Dentistry. I connected with him. I went and became a research assistant in his clinic where I got to do some really cool projects and learn a lot from their team. Kind of one thing led to another, and just realized that more of my passion was in the sort of interceptive space, like what we could do at an early age and intervene to make such a high impact on these children's health and for the rest of their lives.
Yeah, I mean, 100%. I think so much of that is so amazing because really, I mean, I remember when people were still like routinely, I mean, I'm totally dating myself here, but I feel like routinely there was a moment where people were like still getting mercury fillings or like it was still okay to put mercury in your mouth. And like people still have those like from way back in their mouth and like living with toxins. And then I don't think, I mean, even to this day, I don't remember like if I go for like a cleaning or something, which, no downer to conventional dentistry at all. But just saying like it's a different experience with a biologic or holistic dentist, maybe, because I don't think anyone even mentions like, like, do you have like dental amalgams that are or dental fillings that are like mercury, or have you ever had toxins in your mouth, or like are you using like toxic toothpaste, or like I just don't think it like comes up very regularly, which is interesting. And also to your point around kids, like there's so many things that can be affected by airway, and we'll get into that later. But you and I were talking earlier about growth, and I was even kind of like, oh my gosh, I never put two and two together that like your airway can affect your growth and things like that. So it's so important for overall health. And I think just like having the two of us like have like our like being like in our lanes, but also like being collaborative is so important so that we can like optimize like the kiddo's health. So if you don't have a biologic dentist, I do recommend reaching out to Julia because you probably need someone to kind of like bridge the gap, especially if there's not one in your area.
Yeah, I think again, kind of echoing what you just said, it really is like the mindset is just kind of like if it's not broke, don't fix it. Like that's the mindset of conventional dentistry and medicine. And so it's not until we start to really take a step back and look through that broader perspective that we both kind of have turned away from the way we were conventionally trained.
Yeah, sort of getting at like preventing problems, which is interesting because and I get this, I do get this, but it is really hard to like be like, okay, I'm going to prevent a problem because it's hard to see like, okay, I have prevented it versus like if you already have a problem and then you fix it. Because sometimes I have that like in my practice, people will want to come when their kids are already like really sick, and that's fine. Like happy to help and all of that, and definitely can do some deep dive functional medicine. But you guys, even better if you can come in before that happens so that your kid doesn't develop some of these issues. And same, I'm guessing with oral health. I want to totally step back to like the basic basics because some people have like it's their first kid and they just really, or maybe they just like were never taught about teeth. Um, like some people that I know. So when should we even like be worried about kids' teeth? Like, is it like right at 6 months if they come in that early? Or like what if they're born with a tooth? Like, do you brush that or do you have to like take it out? Or like do you use toothpaste? Like, what do you recommend for all of the age groups with brushing and flossing and wiping? Like, should we use that banana toothbrush that everyone uses? What's the deal?
Yeah, so I definitely the standard recommendation actually from like organized dentistry is to see a dentist by age 1 if there's not a problem sooner. That being said, I know that it really varies from office to office what each office is even comfortable as their starting age because not all offices do see children that young. So you have to call around if you're not going into a pediatric office specifically and see what their starting age is. When I say if there's not a problem before age 1, some of the early things that happen with infants that are now being caught in sort of the airway dentistry world are things like tongue ties and lip ties and how that can affect the feeding journey. So some of those issues are being funneled towards dentistry early on. But typically speaking, by age 1, the visit to the dentist should be there. It's not like it's going to be a really conventional cleaning at that point. Like it's more about starting to get the child used to having someone put their fingers in their mouth that's not someone they know and kind of acclimating to the process. As far as the actual brushing, you do, as soon as teeth come out, you want to make sure that something is being used. So for some families, it can just be little gauze squares. I know they have like the little finger toothbrushes, very similar to actually what they sell for my dog, which is hilarious. But yeah, you can put like the little finger toothbrushes on and rub, and then you can start to use things like the little banana toothbrush. So the actual like whether I recommend like one specific toothbrush or not isn't as specific as starting to build those habits early and making sure that you're keeping those teeth cleaned after feeding. So I think that that's a really good thing to start as soon as possible, as soon as those teeth come through. I know some of the kind of next questions with brushing becomes flossing and like when does that come into play? So really, as soon as you have two teeth that are touching, so in an ideal growth and development, there is a little bit of space between some of the teeth as they're coming in. But more and more, because of the changes that are happening to how our bones are developing, a lot of our teeth are coming in closely together and there's not as much space. So anytime two teeth are touching, we want to start building that habit in early and start getting the floss in. I know that trying to floss a child's teeth isn't going to be an easy task. So using things like the floss sticks and things like that to get started is totally acceptable, to just start building that habit in early.
Yeah, I love that. I love actually like sometimes I'll even tell people like even if the teeth aren't touching, just like and I'll get your opinion on this, but sometimes I'm like just like put the floss like near their teeth or the floss sticks or whatever you're using just so they like get the idea that it's like part of the routine even if it's not you're not really like actively flossing. And then when their teeth are touching, they're not just like, "Oh my gosh, like what is that? Like what are you coming at me with?"
Yeah, no, I think that's a great idea. I mean, even within like the realm of pediatric dental visits, there's a lot of like, tell show, do kind of playing with everything before you try and put anything in anyone's mouth. And so certainly that is really the idea of getting started early with the good habits is also just getting these kids comfortable with things that are unknown and new, which is everything at that at that point in time, right?
Yeah. Yeah, 100%. 100. So, okay, so toothpaste. So, I have my opinions on like what I was taught, but maybe things have changed. So, like, what about fluoride? What about not using fluoride? Like, is it okay? Is it toxic? Are we all going to die from fluoride? Should we be using it because of cavities? Like, maybe we should alternate. Like, what's the deal? Are there specific brands of toothpaste or like, can we just use anything? Should we use like a big old like hunk and chunk or should we just use like a little smear?
Yes. There's a lot to unpack there, but it is, um, you know, until a child can actually spit the toothpaste out, it's really not recommended that they're using fluoride because there is some safety hazards with swallowing fluoride. And so it's something where kind of that goes a little bit hand in hand with how the child is developing. But I do recommend starting with a non-fluoridated toothpaste and building up. As you start building up, you can use first like a grain of rice size toothpaste and then graduate to like a pea size amount and then eventually working up towards kind of filling the toothbrush as we're getting older and we can control all of the spitting and all of it. For some kids, there are so many different toothpaste, and I'm not one to necessarily say one brand is necessarily better than another. There's a lot of different options. And again, coming from a biologic dentist perspective, I see the value in things like hydroxyapatite as an alternative to fluoride for families that don't feel comfortable introducing fluoride yet. At the end of the day, I do think it's an individual choice. I think there are a lot of factors that come into play with what causes cavities. And unfortunately, it's been really easy for dentistry to sort of fall back on that as the number one explanation for why cavities are developing is that we're not using fluoride, or if someone's choosing not to use fluoride, but really, diving into diet and mouth breathing and whether your tongue has the mobility to move around and actually clean the teeth. So there's a lot of different factors, what you choose to have, even the texture, not necessarily the choice of food, but the texture of food. So things like raisins are really high risk because they're sticky and they're going to stay on those teeth surfaces and feed some of the bacteria and bugs. So paying attention to the texture of food, obviously there's just kind of a variety of things that factor in there again when it comes to cavities. But if you have any questions trying to find a dentist that matches your approach, I don't think that fluoride is the reason your child probably doesn't have, or the reason your child is getting cavities may not be because they're using fluoride. But that being said, too, I support the individual choice if someone's ready to bring fluoride into the equation. We do transfer bacteria from caregiver to child. And so if you're somebody who has a lot of cavities and you've been dealing with that yourself, knowing that your bacteria can transmit to your child might make them more high risk too. So there's a lot of different factors there.
That's such a good point because I always feel like sometimes when I talk about the gut microbiome, when I bring up like the oral microbiome, I kind of get like like I almost feel like I'm growing like little alien antennas and people are like, what is she talking about? I've heard of the gut, but I haven't heard of this like mouth
It's
microbiome.
the beginning of the gut.
It's the beginning of the gut. You're right, because
Absolutely.
everything goes in your mouth. Okay, that's a really important point if you've been struggling with cavities yourself. And then you said the fluoride alternative is hydroxyapatite,
Yes.
apatite, tate, tight,
Hydroxyapatite. You
tight.
got it. You
Okay.
got it. Yeah, there are some main name brands, things like Risewell or Boca have hydroxyapatite. Feed Your Good Guys is another one that's newer that is hydroxyapatite based that has a lot of support from the dental community. There's definitely different options. Bliss Energetics is another one that's got some interesting products with hydroxyapatite. So there certainly are alternatives for the people who want to seek out non-fluoride options.
Okay. And you had mentioned also like mouth breathing can be a cause of cavities. And that's something I really wanted to dive in today. So, like, if you're not breathing through your nose properly and you're breathing through your mouth predominantly, or I guess also at night, sometimes kids will do it more at night. Like, why is this so important for kids' health? Like, what are the long term effects of chronic mouth breathing?
Thank you. I feel like that's like the single, if there's a single takeaway from today, I hope that this is the takeaway. Mouth breathing changes so much. So our nose was strategically designed to filter the air that we breathe, to humidify the air that we breathe, basically to prepare it for getting into the lungs. And when we breathe through the mouth, instead, either daytime or nighttime. So, snoring is another time in which mouth breathing is taking place. But when we breathe through the mouth, we miss a lot of the preparation that's supposed to happen. And so, a few things can happen. One, our tonsils and adenoids can be left trying to pick up the task of filtering the air before it makes it to our lungs, which can be irritating and cause kind of additional growth of those tissues, which then further enters the cycle, making it even harder to breathe through our nose. So, if we're mouth breathing, it can be structural in origin. So, if our jaws aren't growing to the right width, then our tongue may not necessarily sit up on the roof of the mouth where it's supposed to. Or there can be just kind of muscle tone and different things that are happening that aren't necessarily ideal for whichever reason it may be. If our tongue is sitting low in the mouth, then our faces actually grow differently. So we end up with kind of a longer facial growth pattern. And if you think about the fact that the roof of the mouth is the floor of the nose, our tongue is meant to be one of the primary drivers for how our skull develops. So every time we swallow, that is actually putting certain amounts of pressure on how our skull is developing when it's still growing. And so it's really important that our tongue is up, which happens to be kind of going hand in hand with supporting better nasal breathing. So there are a lot of different things that we can look into to support better nasal breathing, from looking at environmental allergens and things of that nature, and sometimes even doing support with certain therapists that can help retrain if we're not necessarily in the habit. Sometimes it is just a habit. A kid gets sick and then they start that cycle, and then they kind of don't get that pivot to get back to nasal breathing after
Hmm.
illness. So it's one thing that if parents take away one thing, it's just go and peek at your child either at night while they're sleeping or during the day if they have, if they're doing any screen time or anything where there's kind of downtime. Check and see, is their mouth open? Are they kind of resting in that position, or are their lips sealed? Are they breathing through their nose? Because that can tell us a lot more about other facts, other kind of parts of their health.
Okay. Okay. So check in when they're relaxed, when they're having downtime. And if they are breathing through their mouth for more than like what, like a couple of weeks? Would you say
Yeah, I
like
mean, again,
months?
it's when you see that it's becoming a trend, that's where, like, I know that, and it can start early. A lot of infants, you can already see that pattern with a lot of infants, and you want to sort of, I mean, like, you want to start trying to retrain that. There's, of course, an element of, I know, like, lip tape is a big topic, so we can talk about that if people are curious about that. But, like, there are aids to help with kind of keeping the mouth closed and learning. You don't want to tape a baby's mouth shut. I'm not saying that at all,
No.
like, you can go if you see their lips are open, you can just kind of try and close them and try to reinforce the idea behind switching it to the nasal breathing. Because if we don't use it, we really can get more inflammation in our nose as a result of not having the air pass through those passages. And then it just, again, sort of feeds into this cycle of, well, now we're mouth breathing. So it can just be a habit, but there can also be other structural things that are contributing to it.
Yeah, so it sounds like, if it's going on for a while, it seems like a pattern, like good to check in with probably not only the dentist, but also your pediatrician, because I am here to tell you adenoids can get huge and tonsils can get huge. And for those of y'all that don't know, those are the dangly things in the back of the throat. And then also like their cousins. I like to call the adenoids the cousins of the tonsils. So they kind of do the same thing. And good to know that they can like really be relied on for filtering. So that's probably why they get so darn big. It's kind of like my house filter with my shepherds. It gets clogged and just kind of grows. And then that actually can affect the face, like the shape of the face. And it sounds like it can also give you cavities. And let's see, what else can it
Yeah,
do?
sorry, I didn't really make that connection. So, just by virtue, our saliva has a lot of protective factors for our teeth. And so, by virtue of the fact that if we're mouth breathing, it's going to put our mouth in a position of sort of dehydration. We're losing a
Mm.
lot of the protective minerals and saliva protection that is intended to be there. And then, aside from that, also, as you mentioned, like being the beginning of the gut microbiome, it really can alter, you have different bacteria that's gonna settle into an environment where someone's mouth breathing more, and that's gonna feed into the rest of the gut and kind of start creating some gut issues for some families.
Okay. So super important. So how can parents know if their kids like having what am I trying to say? Like if the mouth breathing is so bad that it's starting to cause like some of these problems. Like what should they look for? What are the signs?
Yeah, so I think what we learned in medical school, when you learn about the adenoids, like one of the only things that they'll talk about is like adenoid facies, right? Where this is like a sort of a typical presentation of a child who has dark circles under their eyes. They have sort of a forward resting head posturing, and like their mouth is always open. So there are things we can look at in terms of visibly seeing what's going on with the child and how their mouth is positioned. But also, some of the things are behaviors. So, a lot of people don't make the connection really. If a lot of the kids who are breathing through their mouth, they're going to be snoring at night. And if they're snoring at night, there can be a lot of disruption to sleep patterns. So, just snoring on its own can be really disruptive. I know in adults, we hear more about like sleep apnea as kind of the end stage disease that we're concerned about. But snoring and mouth breathing are really the earlier kind of precursors to that spectrum of issues. And so, if our sleep is interrupted, there's a lot of overlap with things like ADHD and symptoms that come from that. And so that's something that's often overlooked for any kids who are being sort of labeled as hyperactive and kind of feeling like something's going on and you can't quite get to the bottom of it. I highly encourage anyone to just pivot for a moment and make sure, if no one's talked about sleep for these kids, that's such an important key to make sure that some of the symptoms aren't being driven by poor sleep. And the poor sleep could be, in some cases, a result of improper breathing patterns. So things like clenching and grinding of the teeth would be another clue that airway is being affected, especially at night during sleep. A lot of times It may not be an initial connection that people make, but ear infections can be a sign that, again, if the adenoids are enlarged, it can affect the way that our ear tubes drain. Um, and can be a sign that like our swallowing pattern isn't necessarily, again, triggering the way that our ear tubes should drain. Reflux, different things like that can be connected as well, both through sort of diaphragm, kind of the changes of pressure that can be in the diaphragm. Kids who are a little bit smaller on the growth patterns as well may not be getting the growth hormone released at night, because a lot of that is released while we're sleeping at night. And so if a child is having interruptions to their breathing, then they may end up not growing as much as some of their peers. So there are definitely different things to look at when it comes to symptoms, when it comes to looking at someone's face, and when it comes to looking at their teeth. Obviously, a dentist is going to be more prone to knowing what's normal or not normal with the teeth. But if you have kids who are thumb sucking or have pacifier habits, sometimes you can see that their teeth are kind of not closing when they bite together. There's like an open space there. Other times, what's called like a dental crossbite can be a warning sign that maybe the bones aren't developing in the way that they should. So ideally, our top teeth should sit just outside the bottom teeth on the cheek side and up front where the lips are. And if that position is inverted to where our lower teeth either kind of more of like a little bulldog bite, or in the back where the teeth are in a different position on the outside closer to the cheeks, those can be some of the bigger warning signs that growth is being affected.
Hey guys, Dr. Ellie here. I'm just popping in to say stay tuned for next week's part 2 of this episode with Julia Sadove Lopez. And I'm so excited because Dr. Julia has so much to say that was so valuable that we actually had to break it into 2 parts, so don't miss out. All right, see you there. Wishing you well.